If you're struggling to shake shin splints, I want to show you 4 things that I give to my patients clinically that not only address the symptoms of shin pain, but the potential underlying cause of why that shin pain is there in the first place. Like a lot of leg-related issues, shin splints should be considered the consequence of something else. If you have pain along the tibia bone at the front of your shin, there has to be a reason why that exact part of your leg, especially if it's on one side more than the other, has become sore. And if we're not looking beyond your specific shin pain, then we could be missing the thing or things you need to change to give yourself the best chance that this is going to go away and stay away forever. As a physiotherapist, one of the common patterns that I see associated with pain at the front of the shin in the form of shin splints is often tightness through the calf muscles at the back. Now, it's important to recognize that calf tightness alone isn't enough to explain why a shin at the front becomes sore. Calf tightness in and of itself is often a symptom of something else. But it's absolutely worth your time doing an effective calf stretch to hopefully feed some more slack into the tissue at the front of the shin, giving those symptoms more breathing room and a chance for them to settle down faster. So a really simple calf stretch that you can do is just simply to hang your leg off the edge of a step. The reason why this can be quite a beneficial exercise is it does allow you to get lower than the level of your foot, whereas when you do a regular calf stretch and leave your heel behind you, we're not expressing as much range of motion in this position as we are if we're letting the heel hang down below the level of that step. The main thing that we always need to prioritize with any form of muscular stretching is that it's not good enough just to hold this position for 30 seconds and hope for the best. We have to actively engage that calf tightness, which means we need to tense up that muscle for 5 to 10 seconds to get our brain involved, so that when we stop tensing that muscle, the tissue releases and we can drop down even deeper than we could before. Now, it can feel a little bit awkward trying to tense that muscular tightness in your calf without feeling like you're pushing yourself up and away. But if you can stay down low into the stretch, find a good position that feels tight for you, change the angles to find which part of the calf needs to be stretched the most. And then if you can then walk away feeling like your calf muscle is immediately freer, then you've instantly fed some more slack around the front towards that shin to give those shin splint symptoms more breathing room to play. Following on from this, we also need to get to the underlying reasons behind why those shins are sore in the first place and why those calf muscles are also tight as well. And for me as a physio trying to work these things out for my patients, one of the biggest hidden causes that I've found to prompt calves to be tight and shins to be sore at the front is ankle joint stiffness. If that ankle joint capsule, which is the tissue that surrounds the joint, has become stiff, tight, and restricted because you wear thongs or flip-flops, you get around in heeled shoes, or that you tend to sit a lot and don't express that full ankle range of motion, then that added restriction can fundamentally change the way that you load up the structures in your leg, of which the front of your shins and your calf muscles are right in the crosshairs. If you are someone who walks with your feet turned out, or when you run you feel like your knees subtly cave in, this might be because your ankle joint is restricted. And because of this, instead of your legs moving in a more linear up and down piston-like fashion, we introduce more rotation into the leg, which changes the way you load up the tibia at the front and the calf muscle behind. And one of my favorite ways to try and get through some of that deeper ankle joint restriction is with the banded ankle stretch. You want to pop the band onto your ankle underneath your ankle bones, and we want to stretch that band out as far as you feel comfortable before gently trying to oscillate towards the end of your range. And want to work in and out of that range to prompt that tissue to mobilize quickly. It's really important, as we discussed, is that if your ankle joint is stiff, there's a good chance that in order to get around some of that restriction, your foot may turn out a little bit so you can keep going forwards, or you might find that your knee wants to cave in to go around that restriction to give you more range than you should have. So it's really important that we make sure that your foot stays straight, we keep that knee rotated outwards, and we're going out through your ankle as opposed to in and around your ankle joint stiffness. So again, having that band and that leg behind you, dropping that back knee, trying to close down that ankle, making sure that we're not caving in, keeping that knee rotated out. We want to do this for 30 seconds, 60 seconds, 2 minutes, as long as you feel you need to, so that when you come out of that stretch, you feel like your ankle is immediately a little bit lighter and a little bit looser than what it was before. And so not only do we want to try and release some of the hidden and more obvious restrictions in your ankle and your calf, we also want to make sure that the tissue around the front of your shin and the back of your leg are conditioned and strong and robust enough and tolerant enough to handle the load that you need to put through it day to day. So we're going to get to a really important calf raise in a second. But the third exercise I want to go through is an exercise that strengthens the muscles that go through the front of your shin to provide some more specific support to that tibia at the front. And a convenient way to do this is via a tibialis anterior raise. All we're doing here is gently lifting the front of your feet up and then lowering them back down again. them. Just be aware that the further away from you your feet become, the harder it will be. So make sure that you choose a version of this exercise that feels instantly comfortable and achievable for you. We want to make sure that we're building towards 15 to 20 repetitions of this exercise to really target the endurance aspect of the muscles at the front of your shins. Again, if this is too easy for you, make sure that you take those legs out a little bit further away, just so that it becomes harder for you to get over those heels and pull those feet up off the ground. But build that conditioning at the front of your shins to help support that struggling tissue and to hopefully also decrease the risk that that tissue at the front of your shin wants to get sore again in the future. So again, while trying to strengthen the tissue at the front of your shins to make that area more robust, we also want to make sure that the back of that shin in your calf is also robust and strong as well. As with the calf stretch, it's also important to do your calf raises off the edge of a step, because again, we can pair up that deeper flexibility with strength in that deeper flexibility. So you're most welcome to start on 2 feet if you feel like this is comfortable for you, but we obviously want to work towards building you up to doing this on 1 foot to get the most out of this exercise. But ideally, we want to get you somewhere close to 10, 15, 20, up to 30 of these exercises to handle the demands of what your activity might demand of you. But if you can build up the strength and the flexibility of the tissue around your shin, including your calf and your ankle joints, then again, we're trying to get to not just the symptoms that you feel, but the underlying cause of why those symptoms have come to be in the first place. If you are struggling with your shin splints and you would like to talk to me directly, please consider heading to yourwellnessnerd.com and booking in an online physiotherapy consultation with me. There we can talk about the specifics of your shin splints, how they may have come to be, and the unique demands that you may have that might be contributing to why that pain is there in the first place. But having said that, I genuinely hope this video was helpful for you. Thanks for watching, and hopefully I'll see you in the next video that's about to pop up here.